Hey everyone, welcome back to my channel. So today we are learning about 10 signs of bladder cancer. Bladder cancer, formerly known as carcinoma, predominantly affects the inner lining of the bladder and results from abnormal cellular growth that forms a malignant tumor. Transitional cell carcinoma, commonly known as urothelial carcinoma, is the most common subtype of this malignancy. It starts in the urothelial cells that line the inner walls of the bladder. According to Cleveland Clinic, if you have bladder cancer, it may help to know about half of all people with the condition receive treatment when their tumors are limited to the inner layer of their bladder wall. For them, surgery to remove tumors means they're cancer-free. But bladder cancer often comes back, recurs. If you're worried about recurring cancer, talk to your healthcare provider. Thankfully, bladder cancer is often diagnosed in its early stages, when it is very treatable by doctors. Understanding the warning indicators is essential for early identification, efficient care, and a full recovery. Sign number 1. Frequent or urgent need to urinate. Patients with bladder cancer may need to urinate frequently or urgently. Numerous factors influence the average frequency of urine, with daily water consumption being one of the most important ones. Healthy adults typically urinate 4 to 8 times a day. If someone starts to urinate more often, it may be an indication of a bladder problem, such as cancer. The sudden and intense need to urinate, which can result in involuntary leaking, is another possible warning sign. 2. Blood in your urine. Hematuria, or the presence of blood in the urine, is the most prevalent and frequently the initial sign of bladder cancer. When a bladder tumor starts to bleed, this symptom appears. Urine can seem bright red, orange, or pink, and its color can vary. It can happen frequently or sporadically. Sometimes blood is present in minute amounts that can only be found by a urinalysis performed under a doctor's supervision. 3. Repeated urinary tract infections. Because bladder cancer and UTI symptoms are so similar, a doctor may mistakenly treat bladder cancer as a common illness and give antibiotics if they discover blood in a patient's urine during a urinalysis. On the other hand, recurrent urinary tract infections, UTIs, may indicate a more serious underlying illness, such as bladder cancer, if there is no other apparent explanation. 4. Difficulty emptying your bladder. Urinary retention, however, is another way that bladder cancer may present. Complications may result from this, including the inability to urinate when the need arises, trouble initiating a urine stream, interrupted urination, and pain during the bladder emptying process. In addition, after emptying their bladder, some people may feel the urge to urinate. Blood clots that form inside the bladder or a tumor-related obstruction of the urinary tract are the two most common causes of urine retention. 5. A noticeable mass in the pelvic region. A tumor cannot be physically detected in the early stages of bladder cancer by either the patient or a medical professional. On the other hand, a doctor might be able to feel a lump in the pelvic area as the illness advances. This frequently indicates that the tumor has become larger and that the bladder wall's deeper layers have been penetrated by malignant cells. Furthermore, the existence of a palpable lump may be a sign that the cancer has begun to spread throughout the body, or metastasis. 6. Pain and discomfort in the pelvic area. Urinating causes pain and irritation for those who have bladder cancer, often culminating in a burning feeling. They might also have lower abdominal bloating and discomfort in addition to widespread back and pelvic pain. In the early stages of bladder cancer, painful urination is common, although more advanced or radiating pain usually does not appear until later in the disease's progression. 7. Unexplained weight loss. Loss of weight is a prevalent sign of bladder cancer, among other cancers. Numerous factors, including the body's immunological reaction to malignant cells and a decrease in appetite, might cause this. The immune system generates chemicals called cytokines to fight against these dangerous cells when it finds them. Regrettably, the body's metabolism may also be impacted by this reaction, which could result in the loss of fat and muscle. 8. Anemia or low red blood cell count. A condition known as anemia develops when there is not enough hemoglobin in the blood, which is a crucial component of red blood cells that carries oxygen throughout the body. The processes involved in the establishment of the malignant tumor in bladder cancer cases might lead to anemia by depleting the body of essential minerals such as iron and vitamin B12. Lastly, number 9. Persistent fatigue and weakness. Weakness and fatigue are prevalent signs in many cancer types, particularly in the advanced stages. This is frequently brought on by the immune system's secretion of cytokines, which not only induce weight loss associated with cancer but also heighten fatigue. If you're suspecting bladder cancer, talk to your healthcare provider. They're your best resource for information on risk factors that increase the chance you'll have another bout of bladder cancer. They'll help you stay vigilant about symptoms that may be signs of recurring bladder cancer and be there for you if you need more bladder cancer treatment. If you find this video helpful, give it a thumbs up and share it with your loved ones. Subscribe and comment below. For more videos like this, hit the subscribe button and turn on the notification bell. Thank you for watching.